used for the treatment of migraine. The triptans act through 5-HT1B. Triptans act by activating 5-HT1B by 1D. Sumatriptan was the first triptan to have been used clinically. After that, several drugs have been released, and these include naratriptan, zolmitriptan, frovatriptan, and rizatriptan. All of the following antihistaminic agents lack anticholinergic property except this is from aiims November 2017. The options are promethazine, astimizole, levocetirizine, loratadine. And the answer is promethazine. All the drugs listed in the question are second generation antihistaminic agents except promethazine. Second versus first generation antihistaminics, higher H1 selectivity, no anticholinergic side effects, absence of CNS depressant property, less sedation, additional anti-allergic mechanisms apart from histamine blockade. Some also inhibit late phase allergic reaction by acting on leukotrienes or by antiplatelet activating factor effect. They have poor antipruritic, antiemetic, and antidissuasive actions. COX-2 is implicated in. This is from aiims November 2018. Options are cell differentiation, cell migration, cell adhesion, cell proliferation, and the answer is cell proliferation. Which of the following agent is not used for treatment of erectile dysfunction? This question is from aiims May 2016. Options are PGE2, prostaglandin E2, vardenafil, phenylephrine, alprostadil. The answer is phenylephrine. Phenylephrine is an alpha agonist and will cause vasoconstriction, therefore not used in erectile dysfunction where vasodilation of penile vessels is required. Other drugs given in the option are used for this condition. Drugs used in erectile dysfunction: PDE5 inhibitor, sildenafil, vardenafil, tadalafil, avanafil. These are well observed metabolism by CYP3A4. Tadalafil is most potent. All are equally effective. Drug of choice erectile. This is drug of choice for erectile dysfunction, also used in pulmonary artery hypertension. Next, alprostadil. This is PGE1 analog. It is potent vasodilator. It is medicated urethral system of implantation use. Pellet is inserted in corpus cavernosum. Priapism is a side effect. Papaverine or phentolamine induced penile erection therapy for impotence. In patients unable to achieve erection, injection of papaverine 3 to 20 mg with or without phentolamine 0.5 to 1 mg in corpus cavernosum has produces penile tumescence to permit intercourse. This is reversed by aspirating blood from the corpus cavernosum or by injecting phenylephrine locally. Apomorphine has been tried for a variety of uses, including psychiatric treatment of homosexuality. Currently, apomorphine is used in treatment of Parkinson's disease and erectile dysfunction. It was also successfully used in treatment of heroin addiction. For treatment of erectile dysfunction, it is believed that dopamine receptors in the hypothalamic region of the brain are the main target, as although dopamine receptors in the penis to facilitate erection, they do so far more weakly than those in brain. It is potent emetic. The drug reduces prolactin, therefore can correct impotence secondary to increased prolactin levels. Which NSAID undergoes enterohepatic circulation? This is from aiims November 2015. Options are phenylbutazone, aspirin, ibuprofen, piroxicam. And the answer is piroxicam. Piroxicam is a long-acting analgesic due to enterohepatic circulation. Single daily dose is usually sufficient as it is long-acting. Which of the following is not a second-generation antihistaminic? This question is from aiims May 2010 and also November 2016. Options are cyclizine, fexofenadine, loratadine, acrevostine. Answer is cyclizine. Classification: first generation are triple enanamine, pheniramine, CPM, cyclizine, meclizine, cyproheptadine, trazodone, hydroxyzine, promethazine. Second generation are terfenadine, astimazole, cetirizine, levocetirizine, azalastin, mesalastin, fexofenadine, loratadine, desloratadine. Which of the following drugs has covalent interaction with its target? This question is from aiims November 2017. Options are aspirin, penicillin, nitric oxide, bosentan. And the answer is aspirin. Covalent interaction means reversible inhibition of the enzyme. Aspirin irreversibly acetylates the COX enzyme. A 20-year-old female weighing 55 kg is admitted to the emergency department having consumed 10 grams of paracetamol together with alcohol 6 hours earlier. A serum paracetamol level is reported as 400 micrograms per ml. Which of the following is correct with respect to this? This is from November 2016. Options are gastric lavage is mandatory, administration of activated charcoal, abnormalities of the kidney function are likely to be present, hepatotoxicity is likely to occur. And the answer is hepatotoxicity is likely to occur. Ingestion of 10 grams of paracetamol will result in acute poisoning. Chances of death and fulminant hepatic failure are high if plasma levels are above the line joining 200 micrograms per ml at 4 hours and 30 micrograms per ml at 15 hours. Gastric lavage and activated charcoal at 6 hours will not be effective because most of the drug would have been absorbed by this time. Prostaglandins have effects on a variety of tissues. The different prostaglandins may have different effects. Which of the following statement is not correct? This is from May 2018. Options are the human arteriolar smooth muscle is relaxed by PGE2 and PGI2, whereas TXA2 and PGF2A cause vasoconstriction. Prostaglandin E1 and prostaglandin I2 inhibit platelet aggregation, whereas TXA2 facilitate aggregation. Prostaglandin E2 has marked oxytocin action while PGF2A has tocolytic action. Prostaglandin E2 is a vasodilator whereas F2A is a bronchoconstriction. And the answer is prostaglandin E2 has marked oxytocic action while F2A has tocolytic action. PGE2 mainly causes softening of cervix and is utilized for cervical tightening, whereas F2A is an oxytocic agent and can be utilized for the induction of abortion. A 70-year-old man was administered penicillin IV within 5 minutes. He developed generalized urticaria, swelling of lip, hypertension, and bronchospasm. The first choice is to administer. This is from November 2019. Options are chlorpheniramine injection, epinephrine injection, high dose of hydrocortisone tablet, nebulized salbutamol. And the answer is epinephrine injection. Epinephrine, that is adrenaline, is a drug of choice for anaphylactic action. It is given by subcutaneous or IM route in a concentration of 1:1000. IV is rarely used but at much lower 1:10,000 concentrations. The H3 receptor agonist exhibits all of the following actions except. This is from November 2018. Inhibition of H receptor induced wakefulness, increase in H mediated gastrin secretion. Drugs used for prophylaxis of migraine are inhibition of H mediated bronchoconstriction, negative chronotropic effect on arteria. And the answer is Increase in HI-mediated gastrin release. H3 receptors act as presynaptic receptors and decrease the release of histamine and other neurotransmitters. These antagonize HI-mediated wakefulness and bronchoconstriction. These also decrease gastrin release and produce negative chronotropic effect. The therapeutic uses of prostaglandin E1 include all of the following except. This is from November 2017. Medical termination of pregnancy, impotence, primary pulmonary hypertension, maintenance of patent ductus arteriosus. And the answer is primary pulmonary hypertension. PGI2 analogs like epoprostenol and treprostinil are used for treatment of pulmonary hypertension. PGE1 analogs are used for first trimester abortion, misoprostol, impotence, alprostadil, and maintenance of patency of ductus arteriosus, alprostadil.